ACES is our ambulatory care EHR support. It is a program that provides physicians with support in ensuring that they can implement state-of-the-art electronic medical records. Practice should consider electronic medical records in general just because the world is changing such that if they don't have it, they will have a difficult time being an active participant in the healthcare delivery system. But they should consider ACES because we provide the best of class support with an affordable cost. And no one wants to go into this kind of initiative on their own. Our ACES program will allow physicians to get a high-quality EMR system at an affordable price.
ACES is ultimately about enhancing patient care by making practices more efficient, more connected, yet staying independent. The ACES initiative has a good team in place to support the providers. The various doctors have 600 odd EHRs out there to choose from. But what is different in the ACES program is we have come up with a proven methodology and a track record of helping providers move from a paper chart to an EHR, get to meaningful use, and be efficient in their practice.
It's made the practice way more efficient in the sense that we no longer have to go on a chart hunt. It's made it more efficient because we're able to address the needs of our patients right away, so they feel that they have more confidence in us because we have the information that they need and can readily answer some of their questions right away and pass it on. So it makes it easier for our patients as well.
It's had a really big impact. I think it is only after you make the transition to electronic that you realize just how much time you spend and your staff spends filing, pulling up documents, taking faxes, moving papers from one place to the other. So we've really eliminated a lot of the paper. It's all electronic, and it's been a big help.
When a patient comes into the office, we do let them know that we do have another option, which is called a patient portal, and it's just another secondary way that they can communicate with the practice. This way they can do things for our practice where they can update demographics, they can request referrals, they can request prescription refills. They can also view their visit summary online. They can view their labs online as long as the labs are normal and that the physician doesn't need to communicate with them about various issues. That seems to be the thing that they're most excited about. Our patients love it. Our patients absolutely love it.
So patients, if they want to look at some of their records, they can go online and sign in through the patient portal and really actively explore some of their medical records. That's been really helpful to them.
I think that electronic medical records are the way of the future. We think that the ACES initiative has made what seemed to be prohibitively expensive to get started with, it made it economically possible for us to do. And so we are grateful for it. And we can see some of the benefits already.
So if a patient is calling with a problem and I have a message to call them back, and in the course of the conversation they're asking for a result of a biopsy and then a lab test and then an endoscopy report, I can get into their charts right away, right at my desktop. And then at the same time, within instance, I can switch back to the patient that I was working on who may be waiting in the exam room. So there's no delay in terms of chart retrieval, and it's made it a lot more efficient. The information is right there at my fingertips, and I think I would recommend both ACES and eClinicalWorks. I think the infrastructure that's been put together by the Adventist system and the excellent IT staff that supports the system, and also the eClinicalWorks platform and the support eClinicalWorks offers, all are really top quality. They made the transition to electronic medical record as smooth as one can possibly make it. And so I think it's been a real, I would recommend it very highly.